It's another day with the physicians where your health is our business.
The growth spot will end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what
You're welcome back to the different also your regular program.
Bone and joint disorders are the most common causes of chronic pain in patients who have sickle cell disease. The femoral head is the most common area of bone destruction in sickle cell patients, although there are other diseases-related problems. Complications can occur at any location. The location and extensiveness of the problems determines the pain and structural damage. We will be discussing the bone and joint disease manifestation from sickle cell disease with our expert on your regular and favorite health TV talk show, The Physicians. Welcome. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. On today's show, we'll be talking about bone and joint manifestation of sickle cell disease. My name remains Dr. Bolarinwa Yusuf Kadri, and of course, my regular co-host, an amazing, lovely lady.
My name is Dr. Martina Agbere. Welcome to the Physicians, where your health is our business. It's always a delight being here, you know.
Always, knowing fully well that we are working in our purpose. There's a reason why we are here.
Sure.
Enlightenment, you know, getting the right health tips from the physicians.
Education.
If it's any other place you want to get the health tips from, just always stay tuned.
To the Physicians.
Every Saturday, 7:30 p.m. West Africa time. It's always good to reiterate
But
that.
you know it's worldwide. People can actually watch it from anywhere they are.
Once you are informed, it's always good. You'll be able to have better decisions and take, look at the options that are available for you to take. So today is on bone and joint manifestation from sickle cell.
Sickle cell, bone and joint manifestation. When you talk about bone and joint manifestation, what comes to mind is the sickle cell crisis.
Exactly.
The bone crisis. That is actually the one that is most common. Okay? And it's not something that I enjoy talking about, because of if you are involved, if you know what it is or what the patients go through, you wouldn't want people to actually, you want to ask them to do genetic counseling
and take the right decision before bringing children that you as a parent you will perpetually be in pain.
But the truth is, at the end of the day, like one guest said, that you must, when you say fall in love, she said that you said don't fall in love.
Stand up and face it. Not just falling and then you say, oh, I'm AS and he's AS.
So you just listen, just do your counseling. If it is SAS, there is really no need. Don't say, okay, you want
and
to
even if there's a need, of course, there are genetic screening now you can do, but for how long? And if you hold on strongly to your religious belief, why would you want to keep aborting that baby? You don't see them physically, but emotionally or spiritually they've zoned off. But it's good we always have our amazing guests, because this particular guest has been awesome. And I'm sure viewers, when you get to see our guests, you know the reason. If you've been following us, you know the reason why this guest owns it. Like it's like a walking encyclopedia when it comes to his area of expertise. So we'll be right back after this time out. Welcome back. If you're just joining us, or if this is the first time you're joining us, sit back and, of course, take a good ride, because on your regular favorite TV talk show, The Physicians, this is where you get the right health tips for you, your family, and, of course, your loved ones. On our show today, we have an amazing guest. He has been here over and over again from your request, and he has done us again a huge honor to come on board. We have Dr. Akinola Bolarinwa. Bolarinwa Akinola. Which one should we go with?
Bolarinwa.
Bolarinwa Akinola. And he's a consultant orthopedic surgeon with Cedar Crest Hospital. Dr. Akinola, you're welcome.
Thank you very much, Dr. Kadiri. Thank you.
Always a pleasure having you. Welcome.
Thanks for having me as well. Thank you.
Welcome. Really nice seeing you again.
The last time we saw you, you were all bedded. What
How the COVID look there? You had the COVID look there.
Well, I was in the middle of a pandemic, so I didn't have time to go to the barbers. Also, but thankfully this time I hope I'm looking better.
You are looking better then. Now you're looking very
Even
cool.
much better.
Yes, exactly.
Thank you.
So we're talking about bone and joint manifestation of sickle cell diseases, but we don't want to just jump into that. We want our viewers to even know before this manifestation, there's something that they need to even, take into serious consideration. I want you to give us an overview of what it looks like, what it should be.
Yeah, you're quite correct. And again, thanks again for having me here. It's always a pleasure to be here. And sickle cell disease is a really, really, really serious issue. It's a really difficult subject, and I know sometimes it could be a bit emotional to talk about it, but I think it's important to know that, as with many things in life, prevention is always better than care.
Sure.
Yeah.
Even though scientifically speaking, just because two people who are AS come together, it doesn't necessarily mean that they will have a child with sickle cell disease, but it's also possible that all their children could have sickle cell disease. So for each birth, there's about a 25% chance that the child will end up with the SS gene. And the burden of disease is quite huge. The suffering, the pain, the difficulties that these children go through is quite huge. And even though there are modern treatments trying to help to achieve a cure or help to achieve some modulation of the disease, it's still very expensive. And therefore, I think the advice is out there, and I believe a lot of societal organizations are insisting now that people are better advised, they're made better aware that before you get married, before you come together, check your genotype, make sure that you're not giving yourself the risk or the possibility of having a child with sickle cell disease, because honestly it could be very, very difficult to manage, especially if they are the ones that are worst affected by the disease. My heart breaks every time when I have to manage.
You can say that again.
Yeah.
You can say that again.
I've told you before that the youngest patient I've done a hip replacement for was a 15-year-old with sickle cell disease.
And necrosis?
With avascular necrosis. I don't want to do a hip replacement on a 15-year-old.
15?
But that was what she needed at the time. And considering that, hip replacements don't last forever, over time you will start to debone from the bone. You're thinking about before she's age 30, she's needing another one, and then she's needing
another one.
And
so
then you don't have much bone to play with anymore. So it's really, really something that people really need to think about. And thanks for bringing it up, because I think with your head, think with your head. It's always easy to think with your heart, and it's a good thing as well.
Yeah.
But also try and think with your head and try and make the right decision, not just for now, but for the future. As well.
So why do sickle cell disease patients have joint pains, bone pains, crisis?
Good question. So there are quite a few reasons for it, and I'm just going to go through them one after the other.
Okay.
We know that in sickle cell disease, their blood levels are not at the same level as everyone else. They have what's called anemia, chronic anemia, and that chronic anemia is one of the hallmarks of sickle cell disease. So what happens is that when you have chronic anemia, your bone is always trying to keep making blood to try and top yourself up. Also, the marrow, the marrow within the bone that helps produce these red blood cells, over time they expand. And you know, the bone is made of the marrow and the outer lining called the cortex. The cortex is the outer lining is the bit that is the hard bit that gives the structural integrity, while the marrow kind of knits it together. So it's a combination of the marrow and the cortex and the outer lining of the bone. So when you start to have the expansion of the marrow, the lining starts, the outer bone bit starts to thin out. So you have the thinning of the cortex, and as that happens, of course you can have fractures, pathological fractures. It depends on where it happens. It can cause some deformity as well. So that's one of the problems. That's one of the underlying causes for some of the bone problems that people have in sickle cell disease. Because of the chronic anemia, the marrow expands, the cortex thins out, and then they can have fractures, they can have deformities. It could affect any bone, actually. Any of that could be affected. So that's one of the reasons why you could have issues with the bone. And I actually saw, I've seen young children just walking and then the bone breaks. And I mean, you're wondering, why has this bone broken? Then you see the x-rays, and the signs are very classical for the marrow hyperplasia and cortical thinning because of this sickle cell process. The second process, of course, is what is called infarction. Infarction basically just means death. And that basically happens because of the sickling nature of the sickle cell. So the difference between the normal red cell and the sickle cell is that the shape is different. So while the normal red cell is like a disc that can move freely within the bloodstream, the sickle cell is like a sickle. You know, I don't know how many people
like the crescent.
I'm thinking of the farming tool. Anyway, so it's like a crescent, and so when it's going through the bloodstream, it doesn't go as smoothly, it doesn't go as freely, so it clogs up, and as it clogs up, that leads to delayed flow of blood. And because the blood is the oxygen carrying, the red cell is the oxygen carrying part of blood, and oxygen is what we need for our tissues to survive, for things to breathe properly. It now creates a situation of what is called hypoxia. Hypoxia is when you have reduced oxygen tension within the bones, and so the bone starts to die because they're not getting enough oxygen. And this tends to happen within that marrow, within the canal of the bone, and also at the tops of the bone. So if you're thinking of joints, you're thinking of the femoral head and the head of the femur, the head of the humerus. So that process happens a lot in the head of the femur, head of the humerus, within the canals of bone. So this, in fact, is a continuous process, and is one of the common reasons for having bone crisis. So when the infarct is happening, when the sickling that leads to low oxygen, that leads to the death of cells is happening, they could experience pain, and that's often when they come with crisis. They get admitted, and as this process keeps going on and on and on, it leads to a process of necrosis, but the necrosis doesn't stay as necrosis. Sometimes the necrosis, it tries to get replaced with normal bone, and then death occurs again, tries to get replaced with normal bone, death occurs again, and you get to the point where your your joint just doesn't function anymore. The bone becomes hard and really really hard to penetrate. So for instance, if I want to do like a hip replacement in a patient with sickle cell disease, you sometimes go in there and the inside of the bone is as hard as rock. You can't get through, you can't go down, it doesn't function as normal bone anymore. And that's because of this continuous infarction. And that process of infarction can cause pain at the time when it's happening, and then causes problems at the end, where you have conditions like avascular necrosis, the bone completely dies, and then you now start thinking
of a replacement.
What do we do now?
Yeah. Is it a myth or a fact that as you grow older, because you have sickle cell disease, you are likely going to die earlier than the general population? We'll answer that right after the break. We are going to the streets. We're keeping up with the physicians. I want to hear from you. If you or someone that you know that has had any sickle cell crisis from the bone and joint manifestation. We'll be right back after this time out.
Yes, I've seen. It's a relation. We came from Port Harcourt to Lagos. So as we came down from aircraft, it started shouting pains. So we had to rush him to our home. When getting to home, he gave up.
Yes, I have. Actually, this person happens to be one of my very good friends. We both grew up, in our days in the secondary school, and from there we went to the university. He was able to survive, the early years and got into the university. And fortunately, he was also studying to become a medical doctor. So he was having his third MBBS exam. Then he had the attack. The sickle cell issues always come up at interval. And from the hostel down to the clinic, I could see the pain that he was going through, and unfortunately we lost him. That particular episode we lost him, and not just the pain that he went through alone, but the pain the mother had to go through losing him, having survived up to about 24 years, and at the end of it all, he still had to go that way. So it was a very painful loss, and personally, I can't forget him,
Well, I don't really know what actually make them to have those pains.
Because I wouldn't know, my brother. I'm not.
It should be a crime for people with certain genotypes, coming together as couple. And a law should be passed to mitigate against that, because we already know that you're an AS and you're going to marry somebody with an AS. The chances of bringing up a sickle cell child is about 70 to almost 100%. I'm not speaking as an expert, but from my own little understanding, this should be discouraged.
My advice to them is that right from the initial stage that you want to, get married, if you are a man, you have to take your spouse to the hospital to do a checkup, a general checkup, and know whether your blood group and the one that you want to marry is in the same class or are compatible.
As a layman, so I feel, according to what they said people with the same blood group should not intermarry. So they should avoid that, or check their blood group before getting married to avoid having sickle cell children.
Welcome back. I'm sure you had a lovely time with all our guests and people on the street telling us what they feel about the bone and joint manifestation from sickle cell diseases. And we still have our lovely guest in the studio who is giving us, what Nigerians used to call basbos. Is giving us all the facts that you need to know about sickle cell diseases. And I ask, is it a myth or a fact?
It's a fact, actually.
Wow.
It is a
really?
fact. I think we're reversing that trend with modern management and with better attention to care. But the reality is that, especially in a country like Nigeria, where clearly our health system is still developing gradually. We still have a long way to go, but it is a fact that sickle cell people affected with the sickle cell condition have die earlier.
Wow.
Variety of reasons.
So what are the sickle cell and bone and joint diseases?
Okay, great. Thanks for asking that. So I'm back on topic now.
Yeah.
So what are they? So I've already mentioned a couple. So the first one is the possibility of deformities and pathological fractures because of the chronic anemia. So you could have somebody walking into my clinic with a fracture, not because they've had a traumatic event, but because they've had this hyperplasia, thinning that's caused a fracture. You could also have this infarction. Infarction leads to avascular necrosis, and that could affect the head of the femur, the head of the humerus. Usually the head of the femur is worse because you have to bear weight on the legs. So that causes pain, and that pain then could lead to you wanting to have some joint replacement procedure. Of course, it could affect the knees as well. And then you also talk about the bone crisis that happens as a result of the continuous infarction that's been going on. The other one to think about is infection. Infection usually happens because of a combination of one or two things. First of all, the infarction. Once you have a situation of cell dying, that becomes a good culture medium for bacteria. And bacteria is always attracted to where there's not enough life being supported, essentially. So that becomes a good culture medium. But also in the sickle cell condition, there's an organ on the right side of your upper abdomen which is called the spleen, and that spleen helps in the fight against infection. But in sickle cell patients, you get what's called a reduction in the volume of the spleen, which then makes it less efficient at fighting infections as well. So a combination of hyposplenism, which is a reduction in the volume of the spleen, and continuous infection predisposes sickle cell patients to infection. Infection, the medical term could either be osteomyelitis or septic arthritis, which is when it affects the joint. And in those situations, that's another reason why people get admitted into hospital, because when you have infection may lead to fever, may lead to pain, you may have a discharge that is coming out from the bone and coming out, and often people then need to have surgery just to get rid of that infection at that time.
And that is what now will take us to the management. Because it's good for us to know, we've said this, we've told people this is more predominant among the black race, the crisis and all that. They say, we've heard, doctor, so how do we not treat? Because treatment is multidisciplinary, there's a lot of cocktail medication that's all. And of course there are some level of surgery and newer innovations when it comes to this. So please, our viewers,
thank you so much. Again, I'll just reiterate the point. Prevention is better than care. Better not to have to deal with this problem, if possible, than to have to deal with it. But this is life. We appreciate that human beings, we're complex beings, and there's always going to be that emotional aspect to it, and you can't take it away. But when you have a situation, how do you deal best with it? Again, if you maintain as healthy a lifestyle as possible, if you are under, a lot of sickle cell patients are not under the care of hematologists or any doctor guiding their care. I think they should be. I think there should be somebody who is on top of the game, on top of their research, looking after these people, making sure that they're trying to prevent as many crises as possible. They're being put on the appropriate medication quickly. So that's from the prevention aspect. When these things do happen, what do we do? Admission to hospital, most of them have to get admitted. And then you have to get into proper hydration, treat all infections promptly, put them on painkillers. The difficulty with the painkillers, though, is the opioid dependence that can happen as a result. And again, this is a very difficult problem. Considering the fact that this is even a problem in non-sickle cell patients, there's an opioid epidemic in the United States, for instance, at the moment, and a lot of Europe, because any painful condition, people suddenly start going into opioid dependence. And this opioid dependence is even more of a problem with in sickle cell conditions. And I've seen a lot of patients who have come in who have resorted to self-injection, and that has caused a lot of problems. One of the reasons actually why people can die early, because you inject something, you inject wrongly, inject into the vessel, you have a reaction, and that causes an embolism or a clot that can just kill you. So pain management is very, very, very important, and that has to be done under the guidance of a professional who knows when is the right time to withdraw you from opioids. And of course, as part of that pain management, you have to think about behavioral therapy to help mind over matter. I know Dr. Kadiri, her day job, apart from being here as a psychiatrist, so you have to teach people techniques of how to employ their emotional control as much as possible over pain, while not ignoring the fact that they are in pain, because they are in pain. They are in pain, but we have to find a way around this opioid dependence to make sure they don't become, they don't create other problems for themselves.
Thank you so much, Dr. Akinola. It's always a pleasure. Like, I'm here like taking, if I can just be writing, and also most times when you hear how I go back and read up and watch what you've said, and it gives a lot of information. Thank you very much for being part of this show. I remain Dr. Maimuna Yusuf Kadri.
I join my voice to Dr. Maimuna to say thank you very much for coming on our program, The Physicians. While same time next week, try and join us on your regular program, The Physicians, where your health is our business. But then, don't forget to follow us on our social media handles, on YouTube, on Instagram, on Facebook. And if you want to be part of this program, just a click away. Just go on and send us an email. My name is Dr. Martina Agbere.
I'm Dr. Lera Roberts. I'm the second Vice Chairman of the Association of Public Health Physicians of Nigeria, Lagos branch. Please do not play with your life. It is so imperative that you do the right thing. You must keep watching The Physicians for more information.